Hi everyone, it's Dr. Dave, and welcome back to Dr. Dave's 411. Many people think that heart disease is a man's disease. Well, I am here to tell you that it isn't. In fact, heart disease is the #1 killer of women in the United States. After the age of 50, almost half of all deaths in women are due to some form of heart disease. During this episode of Dr. Dave's 411, we talk about menopause and heart disease. Oh, and remember, if you like this video and want to see more, then check out drdavedegatti.com. And one more thing, if you have a heart-related question, message me on drdavedegatti.com. Once a woman reaches 50 years of age, her risk of heart disease starts to increase, and this is most noticeable 10 years after menopause. In fact, women who have gone through menopause are 2 to 3 times more likely to develop heart disease. So what is it about menopause that may increase a woman's risk for heart disease? A decrease in estrogen. Around the time of menopause, a woman's estrogen level starts to decrease. When it comes to heart health, estrogen seems to be magical. So how does estrogen help keep a woman's heart young? First, estrogen helps keep the arteries flexible so they can expand and help deliver more blood to the heart muscle. Once estrogen is reduced during menopause, it is thought that the arteries lose this flexibility and become stiff. Second, estrogen helps to lower blood pressure. As a woman enters menopause, her blood pressure tends to increase, and this can predispose her to high blood pressure. Third, estrogen helps with cholesterol. With menopause, a woman's lethal cholesterol, lethal for LDL, rises, and her good or happy for HDL cholesterol decreases. Fourth, estrogen helps maintain healthy sugar levels. In fact, the risk of diabetes seems to increase during menopause. And finally, estrogen has been demonstrated to decrease inflammation of the arteries, helping to prevent damage to the lining of the arterial wall. What about heart rate, palpitations, and atrial fibrillation? Menopause is associated with an increase in heart rate and an increase in the frequency of palpitations and non-life-threatening arrhythmias. However, large studies have shown that there is no clear link between menopause and a common arrhythmia called atrial fibrillation. So, what can we do to prevent heart disease during menopause? Well, the good news, there are many things. Exercising, no smoking, eating a diet rich in fruits and vegetables, decreasing our processed or refined foods can help lower the risk of heart disease as women age and enter menopause. What about hormone replacement therapy? This is a complicated issue, but I am going to make it as simple as possible. Menopausal hormone therapy is usually indicated for the management of menopausal symptoms, but not for the prevention of cardiovascular disease, osteoporosis, or dementia. This question really needs to be individualized, and you should discuss in detail with your healthcare provider. Few quick jokes before I go. And no, they are not menopause jokes. I am a lot smarter than that. Did you know I used to be a banker? Yes, it is true, but then I lost interest.
I have literally just had a heart attack.
When you get a bladder infection, you know you're in trouble. Urine, bladder. Okay guys, I'll stick with cardiology. And remember, you can reach out to me on my website 24/7 with questions, comments, or if you want to share your favorite jokes with me, just press Ask Dr. Dave on drdavedegatti.com. Okay everyone, there you have it, the 411 on menopause and the heart. Until next time, this is Dr. Dave.